At Weill Cornell Medicine, Department of Urology, we treat urinary incontinence. We treat it in both men and women, but my focus has been on the treatment of women. Urinary incontinence is when somebody loses urine that is involuntarily. That could happen because they don't have enough time to make it to the bathroom, they feel urgency, they have to run to the bathroom, or they leak with coughing and sneezing or any activity.
I think it's so important for patients to understand why urinary leakage happens. There are two main types of urinary incontinence that women may have. There's stress incontinence, the type of incontinence that can happen with activity, cough, laugh, or sneeze. And then there's urge incontinence. Usually that's associated with a strong urge to urinate and feeling like you can't make it to the restroom in time.
The treatment options depend on the type of incontinence. For urgency incontinence or part of overactive bladder, pelvic floor physical therapy is always something that could be very helpful for patients by strengthening the pelvic floor. Medications can be very effective, as well as minimally invasive techniques, including innervation of the nerves that go to the bladder. We can stimulate those nerves by stimulating a nerve in the leg that is a branch of a nerve that goes to the bladder. By stimulating the sacral nerves in the spinal cord to help with bladder symptoms, we can inject Botox in the bladder. A lot of new techniques and things in the horizon to treat those conditions. For stress urinary incontinence, pelvic floor physical therapy can also be helpful, but we don't have medications that can help with that condition. So if you are not satisfied with your symptoms at that point, we use bulking agents that work just like the bulking materials that people use in the face. We can put them in the urethra. They're minimally invasive, very quickly done, and quite effective. Or treatment options like slings and other surgeries, minimally invasive surgeries to cure you from stress incontinence. You should come to Weill Cornell Medicine and New York Presbyterian for the treatment of urinary incontinence because we're at the forefront of research and the forefront of treatment of these conditions. We not only have a multidisciplinary team to treat you, we really are discovering things every day of how to treat these conditions better.
I think the best piece of advice I can give to anyone who might have any of these conditions is that there are options. I think oftentimes patients feel like they're just meant to deal with these, and I think it's reassuring for them to come and talk to someone.
You're not alone. If you only ask your friends or your family members, you will be surprised how many women suffer from these conditions in silence. You don't have to. This is not part of aging. It's not a normal part of aging. These are treatable conditions that if it's affecting your quality of life, you should seek care.